Thank you guys for joining. So as you all are aware, this is the 2026 HMIS refresher training. So we are going to go ahead and get started. Just a few like kind of housekeeping things. If you don't have your last name on your Zoom name, if you could just update that really quickly. We do have Cheyenne, our office coordinator, joining us today. She's going to help us take some notes and do attendance and make sure everybody gets credit for being here. So if possible to update that, that would be helpful. We are recording the session, so anyone that needs to reference any materials from the session, any notes, questions, things like that, it will be recorded. Our office does have a policy where we don't allow any AI, like note takers or things like that. So if you get like a decline for that, it's just due to that policy, but the training video will be uploaded to the COC YouTube page. You also at the end will get the slides with all the details. And also I'm going to go over just an HMIS cheat sheet of things that we talked about, specific, kind of questions that folks may have. And then we will have time for questions at the end. So I'm going to go ahead and jump into things. I want to be respectful of everybody's time. I don't know that we'll need the full hour and a half. So hopefully, if all goes smoothly, we can get you guys a little bit of time back in your day. So we will go ahead and get started. I think most of you know who I am, but for any folks that might not, my name's Megan. I'm the program coordinator for housing and community health here at the George Washington Regional Commission, and I help staff the Fredericksburg Regional COC. We oversee the HMIS system for our community and do trainings like this. We do new user training. Some of you have done training within the last year, so this will be familiar to you. And then we have many, many legacy users on the call. So thank you guys for joining us. All right. So, what are our kind of core objectives for being here today? Folks who have been with agencies that have been using HMIS for a long time will know we do this refresher training once a year, really just to make sure we're reinforcing that core HMIS knowledge. We're going to talk through common errors and kind of best practices, things that are popping up that we hear from you all that are problematic in the system or things that we've done to fix, and then just common errors that we're seeing on a regular basis that can help us with data quality. We're going to talk a little bit about system and policy updates. There's really not a whole lot of changes from last year, but we will go over access to the manuals and all of those things too. And then really, I think the core piece of why we want to gather everybody together once a year is to make sure that we're supporting that data quality and compliance with the system. There are, of course, a lot of pieces of the system that can be a little arduous to work with and kind of frustrating. So things just fall through the cracks. And so we also recognize with staff turnover, things like that, we want to make sure everybody is up to date. So a little bit of background. I think most folks are familiar at this point with what the COC is, but I will give just kind of a brief overview. Here at the COC, we are a federally mandated network of organizations that's working to combat and end homelessness in the community. We work with the localities that are in Planning District 16. So that includes the city of Fredericksburg and the counties of Stafford, Spotsylvania, King George, and Caroline. So the five localities within our region. Many of our agencies, which you all will be aware, work outside of just those five counties, but our catchment area is that Planning District 16. And so really our goal is to help provide planning and coordination for homeless services. And so a big part of that is the HMIS system, which is why we're all here. We help to do trainings like this. We also do a lot of support on the data back end of things. And so we'll talk through what some of the implications of that is, and what some of those issues that tend to pop up from time to time are that we can help kind of manage on the back end. So just kind of, general overview. I think everyone, of course, is going to be familiar with what HMIS is, but HMIS is that generic term for any kind of database that's used to store client level information, as well as any kind of aggregate data on homeless populations that are being served anywhere in the United States. So HMIS systems are used across the country. There are different implementations of HMIS, and that really just means there's different software that folks use and different organizations that kind of manage those systems. But the system itself is used across the United States for a lot of different data collection. Um, a good way to kind of equate it is it's very similar to an electronic health record for folks that are experiencing homelessness. So HCIS is the Homeward Community Information System. That is the implementation of HMIS that we use. That is run through an organization called Homeward. Homeward is the lead agency for the Richmond Continuum of Care, but their implementation of HMIS includes, of course, them there at Richmond, the Western COC, which is out Shenandoah Valley, kind of northern area, us here in the Fredericksburg Regional Continuum of Care, and then what's called the balance of state. And what that means, balance of state, is coverage for a lot of the areas in the state that may be more rural, maybe not have as many folks that are experiencing homelessness or don't have the agency capacity to run a full COC. So they work and coordinate with what's called local planning groups, or as you can see on the screen here, LPGs. And so it's a pretty wide geographic area that the implementation of HMIS that we use covers. And so what that means is we are able to see data from across all of those areas that are included in that implementation. So as you can see, of course, why is that important? We use HMIS to make sure we're enhancing that system coordination. Of course, there are data points that are related to funding and performance metrics, and we operate on a data-driven decision-making model. So what that means is we take the data that you all are entering, and that data helps to inform how we improve and operate the homeless response system overall. And so it's really critical that that information is as accurate as possible, that it's getting updated when something changes, that we're plugging in information about folks' history that's relevant to their record so that we can make sure that we're tracking those things accurately and we can continue to support the system overall and by extension, you all as various levels of case managers within organizations. So first, one of the most important things about the HMIS system is issues related to, privacy, consent, and security. Certainly in the times that we're in particular, we want to be very, very aware of what we're doing with people's information and making sure that we are um, using that information in a way on the systems level that's de-identified, that client consent is, of course, implemented when you're looking at collecting any information. So, of course, informed, voluntary, and documented. So there's a number of ways within the HMIS system to include that client consent. Most of you are going to be using the ROI tab. And so we talk about this in the new user training. It's really important to make sure that that ROI or release of information is updated, that it covers the programs that you're working with, and that folks really understand what that release of information is giving you access to. Because we work with so many different communities that are a part of that same implementation, that means that data, depending on how the ROI is entered into the system, that means that certain pieces of information are available to anyone that is using that implementation. So any agencies, case managers, admins that are working in those areas that we talked about previously have access to certain pieces of information. Now, if someone chooses not to provide a release of information, it's really important that, we um, set like a good expectation for them of what that data is being used for. It can help with, of course, continuity of their service delivery, making sure that folks within your agency are able to access that information. But we really want that consent to be informed as well as documented. So making sure that that is really core to what we're talking about. Data privacy, we want to only collect what's necessary and we only share what is going to be authorized. Again, if you're using that data outside of the system for any kind of reports for your own agency, or certainly for a lot of folks working with nonprofits, data around who you're serving for donors and fundraising, those types of things, you want to make sure that you're only using de-identified data unless that person's consent really allows otherwise for that. System security, this is a big one. We just like to plug in some reminders. I think for the most part, folks are really good about adhering to this, but when you're not using an HMIS, you want to make sure you're logging out. You don't want to leave it up when you're walking away from your computer, recognizing you have people's personal information on the screen. Really important, again, to make sure we're protecting that data and adhering to those privacy um, expectations. You also only want to be using HMIS on approved devices and networks only. This means like you should not be accessing this information on your personal devices outside of your work time for really any other reason than directly related to your case management needs. And then record retention in paper forms. If you are using paper records, you want to make sure they're stored securely, making sure that that data privacy is being protected, shredding any outdated documents, of course, and then following your own agency's privacy policies, as well as any kind of system policies, as well as the COC policies. So. Best practices that we like to go over. There are a number of these that can help that we typically see kind of pop up over time to time. So really a lot of what's contained in this training today is what we have seen in the past that continues to pop up. I will say this is going to be really similar to last year. We have not had a whole lot of updates and we have had a lot of staff turnover. So these are a lot of issues that continue to pop up, especially when folks are newer in their roles. One thing that is really critical in making sure that folks are in the system the right way is avoiding duplicate clients. So when we go through the new user training, we always talk about making sure you're searching thoroughly within the system before you create a whole new profile. As users of HMIS, we're all aware that the system can be a little finicky with how you're searching for people. Sometimes it will find someone with 3 letters and not 2 letters, right? We recognize that's a little bit of a limitation, but please make sure you're doing your due diligence to avoid making a duplicate client. You really want to search that person before making a new profile. You can use multiple identifiers. You don't just have to use their name. Also, utilize their date of birth, their social, things like that that you know are going to help identify them and make sure you're not duplicating that record. Now, if you do accidentally make a duplicate client, we can correct that, but we want to make sure that we're doing our due diligence. The second, and I would say one of the most important things is making sure you're entering data in a timely manner. So we'll talk through kind of what the expectation is for certain programs, but making sure you're completing those entries within days of the interaction. So we recognize like that we don't operate in a perfect world in this field. Things get really hectic. They can be things pop up at the last minute. You get pulled away. You're all carrying a lot on your load in terms of work and the various things that you get pulled into. So we recognize like it's not always going to happen that way. You're not always going to be able to sit down and just plug it in directly as you're doing it. But we really want to make sure we're as timely as possible because that will help us avoid entry errors, missing things, forgetting information, those types of things. So please make sure that you're entering folks in as timely a manner as you can engage with. Updating information regularly. There's a lot of features within HMIS to use interim updates for updates and changes in things like income, people's housing statuses, services they're receiving, assessments, those types of things. And so making sure that you are doing those interim updates when those changes occur is really, really important. The implication of that is when you are moving someone from maybe one program to another, and the information hasn't been updated, then the data really isn't reflecting what that person's real needs are. It can cause a lot of issues on the back end in terms of tracking and how we kind of monitor those program successes. You also want to make sure folks' household members are accurate and current. So we know with folks experiencing homelessness in our HMIS system, a household is anyone that that person deems to be within that household. It doesn't just have to be a family relation person. And those things change, right? We may have folks that have a certain household makeup at one time, things change, someone gets access to services, or someone is able to self-resolve. Maybe they're not a part of that household anymore, or maybe folks have added people in their household, and that's completely fine. We want to make sure that those are reflective in the system of what folks' real lived experiences are. And then following your project's workflow. So sticking to your program's expected process. What that means is making sure you're completing the correct assessments, you're including the right data points, and you're updating your client's information as is laid out within your expected program processes. And really, the number one best practice is if you don't know and you're not aware, that's totally okay. Please just ask the question. We're here to help at any time. All the agencies do have folks that work on more of an admin level at their agency, but that doesn't mean that we at the COC are not available. We're always happy to help answer questions if something pops up or the system looks kind of weird, or maybe your access should be this or should be that. Those things happen all the time, and we're always here to help support you in that. So, project workflows, we're going to talk a little bit about kind of what that process looks like, and then we're going to talk a little bit about some of the data quality pieces that go along with that. So the really important things are kind of highlighted here in these buckets. Of course, you have your project entry, you have those updates, and then you have your project exits. And so at that entry point, some of the core things to really remember and be aware of, you want to make sure your project start dates are accurate. You want to make sure you're completing all of your like baseline information and demographics as folks are coming into those projects. And then you have to make sure that household members are connected when folks are in that same household. So it's really important, in particular, that project start date. Uh, the reason why that's so important is our most of the grant funding for the projects, especially housing projects, a lot of them are on a timeline. Once someone is enrolled in the project, they have X amount of time before that funding is no longer eligible for that person. And so making sure that the start dates are really accurate, help us track how people are flowing through that. We also want to make sure that that information, in terms of all of the like assessments and demographic information, is as complete as possible. Now, we recognize also that folks are not always going to be comfortable sharing some of that information, and that's okay. You just want to make sure you're doing your due diligence to get as much of that accurate information as you can. And then again, we talked a little bit about households already and why folks need to be connected. It also can help in terms of housing options for folks. So when you're looking, certainly when folks are in the process of trying to find housing, they're working with you as case managers or housing locators. It is really helpful to know what their housing household makeup is going to be, if that household is going to remain the same and together through the housing journey. So that's, a little bit of why those pieces are so critical. When it comes to updates in the system, of course, you want to be updating this information as you get updates. There are some timelines for interim updates, interim assessments, and we'll talk through some of those. But in general, whenever whenever any kind of major change occurs in your client's life, for example, income or benefits updates, certainly changes in housing or employment. You want to make sure that those things are getting updated in real time. Again, this is a required piece of that data entry. It helps us track how folks are being served by the system and not just directly in the housing projects, but all of the wraparound services and support that you as case managers are providing to clients. These things help us track those things, help us be able to really celebrate those wins when you guys are able to really support people and guide them through that process, and also help us to identify where there are areas where we can help lend additional support to you as frontline staff in those types of endeavors. Those updates are also, like we talked about, those interim updates are required annually. So we'll talk a little bit about the timeline for that, but you want to make sure you're doing at least one annual update from that project entry start date. So 1 year from that time, you're doing a update on folks' data within the system. You also have a lot of data points at someone's exit of a project that are really important. The reason why these things are important is because we want that information to be as reflective of what we're seeing clients move on from projects to, whether they're going into permanent housing, whether they're going into a subsidized program, whether they have self-resolved. It's really important that we can track folks through the system and make sure ideally, that they are able to exit into a permanent housing situation. And hopefully, of course, the goal of all of our work together is to make sure that they stabilize and, you know, decrease as many returns to the system as we can. So again, in terms of data and the dates, that accurate project exit date is really important. You want to make sure, again, that it's reflective of when the person actually exits. A big one that we see a lot that gets missed is the reason for leaving or destination, where folks are going. Those pieces are really, really important for us to track and make sure, helps us make sure that programs are being effective, that your work is being captured, and again, that we're able to really celebrate all the wins that you guys have working with your clients. Um, Exiting all household members when that's applicable. This happens a lot too, where we see the main person that's enrolled in the project maybe is exited, but it's not reflective. That can cause a lot of really wonky things within the system. So please make sure that if someone is a part of a household and they're all leaving the program, that you exit folks together. And then documenting outcomes. So making sure we are updating what their income was, what their housing status was when they exit the project, because likely that is going to be different from when they entered the project. Again, a credit to all the work that you all do in the community and all the folks that you're working with, all the support that you provide them. All of those updates should be reflected within that client profile in HMIS. Okay, we're going to talk a little bit about data quality. And so high quality data is comprehensive and reliable, as you can see on the screen. That is the goal. We want to make sure that we're checking all of these boxes when it comes to data quality. Um, Basically, what that means is that the data is entered in a timely manner. The data that's entered is complete and it is accurate. And so we're going to talk a little bit about kind of what those mean, what the timeline is, and things like that. But I probably don't really have to explain the importance of why all those things fit together. But it covers kind of the gambit of all the things that we've kind of talked about leading up to this is we want to make sure that it's comprehensive, that that data is reliable. We'll talk a little bit later on about what we use with some of that data and who that's shared with, why it's really important, but it really helps inform a lot of larger like system level decisions when it comes to our local community. It's shared with a number of different agencies and funders as well. And so it's really important that those things are as accurate as possible, that they're complete, and that they're entered in a timely manner. So in terms of timeliness, again, that the goal really is to enter that data as soon as possible. Again, we recognize this unicorn world doesn't always exist and operate that way, but please, whenever possible, you want to make sure that you're committing time and energy to getting that data in as soon as possible. So for folks working in coordinated assessment, that's going to be our homeless helpline. Um, Really, that data should be going in the same day. It's really important that that information is in the system. So then as folks are getting routed or referred to different agencies, that that information is available for them. All other project types, the data timeframe really is 3 days when you should be getting that data in. And that's going to be your initial project entry, all of that demographic data that we talked about. And depending on when folks are doing assessments based on your agency's kind of guidelines and policies. But at least that initial information really needs to be entered within 3 days. For data completeness, our goal, of course, is as little missing data as possible. You can see here on the screen, these percentages are set by federal standards of what percentage of data is allowed to be missing or percentage of folks not knowing or, essentially what is like quote unquote allowable by the system in terms of folks not wanting to provide that information. So you can see here for street outreach, it's a little bit higher because we recognize, of course, you're working with folks that may be a little bit more transient. Folks might not stick around. They may just be passing through versus some of these other project types. You have that longer term kind of touch base with folks. And so that percentage is a lot lower. We've recognized, of course, there are going to be pieces of information that are more sensitive. You can see here, social security number is one that we have a higher percentage allowable just in recognizing that information is very personal. And so some folks might not feel comfortable sharing that, and that's okay. You just want it to be as little as possible missing. This also includes that information in those initial assessments. So things like income, insurance, and we'll talk through some of those things a little bit later, but making sure that that information is entered. If it's not entered, it creates a lot of flags on the back end and the reporting, and then we have to go back and kind of diagnose. Is it missing because the person maybe didn't want to share or didn't feel comfortable, or is it missing because we just didn't enter the information accurately? So again, helping in terms of the timeliness, that completeness, they're kind of tied together. So yeah, so all other project types, it's going to be 2% for missing. For the don't know or refused is 3%, up to that 5% for Social Security number in particular. And then the last kind of leg of that stool is going to be accuracy. So, of course, we want the data to be consistent. We want it to be truthful and accurate, making sure it's really reflecting um, what that client's situation is. So the data entry itself is standardized by those policies, procedures, and standards. When you all went through your new user training, you received copies of the data standards manual as well as the HCIS policies and procedures. Those things are available. And at the end of this session, we'll also send out a cheat sheet as well as like the updated copies of these. They update them for the most part annually. Sometimes it goes a little longer. In terms of the data standards manual, it's really, really granular information. A lot of it you're not necessarily going to have to deep dive into, but if you really want to like really understand the data about the data, you're welcome to dive into that. We're also happy to sit and answer any questions if something pops up. And those manuals, as well as the policies and procedures, can be really helpful in just understanding what parts of the data entry is standardized, right? And what essentially what implication that is. So again, we really want to make sure that it is like fully reflective of the situation of your clients in particular. So why is it important? I feel like we've talked a little bit about what that means in the system, but outside of that, on the larger scale, we use this data for a lot of different things. Like we talked about, it really does help inform the direction of our services in our community. It helps us to understand where we may have holes in the system or trends or problems that are popping up. Again, to really reiterate, we really want to be able to highlight the amazing work that you all are doing as frontline staff, and that data reflects that. So we are able to take that, share it with folks on the local, state, and federal levels to really showcase what our community is doing. We have a very effective homeless response system, and that is attributed to you all as frontline staff. We want to be able to celebrate that. It also helps measure outcomes, inform system changes. We recently did, for example, a gaps analysis, just to help identify, where holes in our response system may be. What are things you all are seeing as frontline staff that can be helpful in providing support to you all and evaluating the data, and the data quality was a big piece of that process. We also want to measure progress towards ending homelessness in our community. That is the goal of all of our work. And so we have to be able to measure that progress as we continue to help serve folks that are experiencing homelessness in our community. Where does that data go? So on the local level, the COC is governed by a board that is made up of a number of representatives from agencies, community members, local government. And so they evaluate this data and this information, our various committees. I think most folks are going to be familiar, but under the board, we do have a number of committees, a lot of working groups that are focusing on various parts of the system, planning, making sure that things are running effectively, that programs are adhering to standards, those types of things. And so our boarding committees evaluate this data. We also have, for folks that are working on more of the reporting side of HMIS, we evaluate a lot of that data as well and help agencies make sure that their data quality is up to date. So on the local side of things, it's a number of folks that are within our current system. But like I said, we also share these things with state and federal entities. So we work closely with the Virginia Department of Housing and Community Development, or as you can see here, DHCD. A lot of state funding is related to how this data reflects what our community is doing. We also work and share data with HUD, which is the Federal Housing and Urban Development Department. Excuse me. And that's tied to federal funding. There's a lot of reporting that goes into that. And then we also share with both state and U.S. Legislators. And so U.S. Congress homelessness policies are derived directly from what this data looks like. So again, when you're kind of zooming out of the day-to-day working with clients, it's really important. To have that data be as accurate and complete as possible. There's a lot of reporting. For example, the annual homelessness assessment report that goes to U.S. Congress. We do, of course, folks will be familiar with the point in time count, as well as the housing inventory count. Those things are reported to HUD for federal funding discussions and discussion, or excuse me, and decisions. And then on state funding, there's a lot of quarterly reporting that comes from this data. Folks may have heard CAMS. There's a lot of reporting through that system for the state level with DHCD, and also the Homeless Outcomes Community Report. So there's a lot of things that folks are working on a monthly and quarterly basis to present this data to funding agencies and decision makers that helps determine essentially the direction that our response system is going to go. So again, it's really important when you, of course, when you're looking at working with clients directly, but it's also really important on kind of that grass tops level where we're sharing all this information with different agencies across the various government spectrums. So roles for different users within that data quality. Here as COC staff, we do data quality planning and monitoring. So we work with you all, especially folks who are doing reporting processes within HMIS for your agencies. We do training and support, of course. And then on that program level, your program administrators are working on that daily workflow with HMIS, the data collection processes, assessments, things like that, and then monitoring on that project level. And then users, you all as users, it's, helpful for client communication. You're doing data entry and then understanding those requirements. So that's kind of the general overview of where we all kind of fit within that process. Want to talk a little bit about some things now that continue to pop up as challenges for folks when they're using the system. Again, HMIS as a program system can be a little wonky sometimes. We talk often about there sometimes can be this disconnect and like the user experience, like you all like entering the data and what that looks like versus kind of the back end coding side of things, where there's entire teams of people working to set up how the system looks to make sure that, that button that you're clicking like doesn't then give you an error somewhere else. Like those pieces aren't always as connected maybe as they could be. So there are issues that pop up with the system that like we'd like to talk through. The first one is going to be fixing versus updating. So that sounds like it would be largely the same function. But if you have entered incorrect information, you want to fix it. So essentially, if you had the date of birth wrong, or maybe you were missing part of the social, or entered, someone's income incorrectly, or maybe they had an old one and you realize that it's been updated or that it's been no longer relevant, right? So if you've entered the wrong information, that is what constitutes fixing something. If you have found new information or something has changed, that is when you will update that. And so again, you want if you're updating something, you can create that interim review and update the data. You don't want to change the original data. If you're getting new information, something's changed, maybe somebody got additional income, maybe they got insurance, you still want the record of what that originally the information was. Again, to help us kind of track it over time. If you entered the wrong information, you will correct and edit the original data that you put in because we want to make sure it's accurate from the beginning. So we get a lot of confusion around these. Again, it's really important as you're doing those interim reviews, you're updating data, that you're keeping that original data intact. Another thing that pops up is entering data as and backdating. So we talk a lot about this in the new user training, especially as folks are like getting familiar with the system. We've done a number of things over the years in how folks are entered into a project that you're working on versus if you're entered as a user just for your agency. It depends then that will dictate how much access you have if you are working on various projects within your agency, those types of things. If you are entering data in a project that is not your default, so say, for example, you are working at MICA, you are entering something for the folks at Respite, but that's not your main project, you will enter data as in the Respite project. And so for the most part, folks are going to be entering data in their specific projects. But in the event that you're not, it's really important that you are setting the system to understand why you're entering it in a different project, essentially. So there's a button you can see here. This is a screen grab of what the system looks like. Enter data as and backdate are really like they're right next to each other, so it makes that easy. But you want to make sure that it's reflecting what the system is, because if not, not, then you will be entering data in a project that that person might not be enrolled in. It can get really confusing. So making sure that that's accurate is really important. Also, the importance of setting the correct date. Again, expectation is you're entering it as soon as possible. If you're not able to enter it on the day that you're collecting the information, we have this backdate function within the system to help make sure that the information is still accurate on the program, or I'm sorry, on the system side of things. And so essentially what backdating does is it tells the system I'm actually entering it on Monday, which is, the day that I collected the information, even though maybe I'm entering it on Wednesday. So it's really important. Again, that helps dictate the project timelines. You really want to make sure that those things are as accurate as possible. Another thing that pops up a lot is residents prior to project entry and accuracy around this. So you really want to make sure that you are reviewing at the time that they're being entered in a project to make sure that that is accurate. So as you can see, we have a couple definitions here. We see this a lot with folks moving maybe from the street into shelter or from shelter into housing. You want to make sure uh, for your project type that you're entering that accurately. So for any shelter projects, the residence prior definition is going to be the client's living situation just prior to entering shelter. So for the majority of folks that you're working with, this is going to be places not meant for habitation. Maybe they're sleeping in their car, maybe they're outside, right? Those homeless situations. For all other projects, you want to the client's living situation will be at project enrollment. Okay, the next kind of bucket that we want to talk about is answering chronic homelessness questions. So, as a reminder, chronic homelessness is either a period of homelessness that lasts for more than 1 year or four or more episodes of homelessness in the last 3 years while having a disability. So, the system is unfortunately, again, kind of particular in what a break in homelessness means, and this can get really confusing on the case manager level, right? Especially when you're working with folks that often have experienced many episodes of homelessness. There are a lot of changes in kind of what that looks like. And so the system has like a set way of looking at what is considered a quote unquote like break in homelessness. And these are all dictated by a lot of policies that we cannot change. Most of these are federally mandated. And so we have to go with what the definitions of these breaks or periods of homelessness mean. So a break in homelessness means either 7 nights or more in a transitional or permanent housing situation, or 90 days or more in an institutional setting. So it's really important that helps you add up what their length of time homeless is. It also is important to make sure that this information is accurate because folks that are chronically homeless are eligible for different programs than folks who maybe are in their first episode of homelessness or their episode has been brief, right? Those types of things. So those chronic homeless questions are really important to make sure that we're routing folks to the most appropriate project. Okay, the next thing, and I would argue maybe the most important piece of this training, because this is what we see the most, is sub-assessments. So folks who have gone through the new user training recently will know we really, really harp on this. You are all familiar with what it looks like in the system. You can see here on the screen, for example, it has income. You have this HUD verification little button here. When you are completing a sub-assessment for the first time, this is one of those weird system things that doesn't make a whole lot of sense, but when you're adding it for the first time, you do not want to use the add button. you want to click on this HUD verification button because it's going to allow you to complete all of them at one time. Especially with things like income, insurance, a lot of folks, may have multiple kind of streams of what that looks like. But a lot of folks are not going to have any. Sometimes when they're coming into a project, they might not have any income at all. And so instead of adding and saying no to like all of and I can't remember exactly how many are in each bucket, but there's a lot. So it just will make it much easier on you and it will help make sure that you don't forget to click yes or no to some because for these, the system requires that you answer yes or no to all of the options. So when you're first adding it, make sure you click on that HUD verification button and you can default to no to all of them and then just change it for the ones that you are saying yes on. It will make your life a lot easier. If you don't have these completed, it will flag it as incomplete in the system. So when we're running those reports that we talked about earlier, these pieces of information are really important to make sure that it's complete. Now, if you are updating something or changing something, that is where you will use that little pencil. You can see here on the bottom example, something has already been entered here. Maybe you need to update it or change it, excuse me, fix it, whatever the case may be. You'll then click on that little pencil and update it there. Okay, the next thing that we really see a lot of confusion around is defining what that residential move-in date is. You can see here, and I think this chart is really helpful as like a visual learner myself. It's important that you see kind of the whole timeline there. So you can see, and a lot of folks that are coming into our programs are coming either from shelter or street outreach records. They're then moving into housing and they might not be, there's often a lot of overlap there, right? So as someone is, maybe working to find housing, they're enrolled in a rapid rehousing project, but they're still living in shelter because they haven't found a place yet, you're going to have those things overlap. And that is where that move-in date becomes really important. As you can see here on the bottom, little timeline for permanent housing records like rapid rehousing, permanent supportive housing. You have your project start date and your housing move-in date. So your housing move-in date also corresponds with the end date of whatever their shelter or street outreach record was. So it's really important that those things line up. This applies to any permanent housing project, both rapid rehousing and permanent supportive housing. Okay, client destination. This is another one that we see a lot of questions around. So temporary versus permanent tenure. So examples of temporary destinations would be place not meant for habitation, hotels or motels in particular, paid with or without emergency shelter voucher. So it's going to be either of those cases. Long-term care facility or nursing homes. Those are all examples of temporary destinations. Permanent destinations are going to be moving into housing, of course, moving in with family or friends if that is going to be a long-term situation. And really for the housing, it can be either through an agency subsidy or on their own. So it's, easy to get some of those mixed up, especially when it comes to folks' hotel stays or exits back into homelessness. Okay, we talked a little bit about the annual assessment. So for making sure that we are updating these records annually, it is required for every project uh, within that 1 year date. So every annual assessment must be completed within 30 days of the project start date. So what that means is you have this window of time to complete that annual assessment. You have 30 days either before or after the anniversary date of them being enrolled. So you have a little bit of time. It's not like the day comes up, you have to do it immediately. You can do it as you're leading up to that. You can also do it within that 30-day period after that timeline. And that just, again, make sure that that information is getting looked at on an annual basis. Those things are still reflective of what that client situation is. And we're able to have that information be as complete as possible. Okay, so just kind of a summary, because I know we just talked through a lot of information. We talked about some of the data quality issues, in particular, entering data as, backdating, um, updating data from prior entry or exit records, residents prior to project entry, chronic homelessness questions, sub-assessments, and that includes income, non-cash benefits, health insurance, and disabilities. We talked a little bit about the residential move-in dates and destination issues, and then temporary versus permanent tenure, and then the annual assessments. So I feel like I went through that a lot faster than I was anticipating. Um, but I want to make sure that we leave space for questions. So I will open it up to the floor. Feel free to come off of mute and ask a question if you have one, or if you want to pop something in the chat, we can go over it too. If I need to follow up with you afterwards, or you want to have an offline conversation, just shoot me an email. We can do that too. Um, but any questions?
I have a question, Megan,
Sure.
regarding breaks in homelessness. It's sort of a two-pronged question. Firstly, if someone is hospitalized, is it 7 days or more, or 90 days that would constitute a break? And secondly, hotel stays. It's always been my understanding, and please correct me if I'm wrong, that a 7 day stay, if it's self pay, constitutes a break. And if it's somebody else is paying for the hotel stay, there's no break, given if, in fact, they were homeless beforehand. So I guess there's
Yes.
three questions there.
Yep, that is correct. So for the hotel stays, yes, 7 days or more if they are self-paying. You are correct. If an agency is paying or it's on a voucher or subsidy, yes, that still counts as that same episode of homelessness. For the hospital, it does fall under the 90 days because it will be that institutional setting. So that can be medical hospital, that can be mental health hospital, any kind of institutional setting. So you're correct as well, 90 days or more.
Okay, thank you.
Yeah. Any other questions about kind of what we've gone over? Any issues that you all are having with the system that you wanted to talk through, or maybe have some additional training on? What are, if, if anything, what are some things that are popping up for you all as users?
Hi Megan, this is Nancy. Can you hear me?
Hey, Nancy. Yes, I can.
Sure. Okay, so I've been seeing a lot of especially when we get like reports, things and stuff, that a lot of our things are getting dinged that we have not entered, but we have entered, and I feel like it's an old entry. So how does I don't know if there's a fix or anything, but it's just getting frustrating when we have to go through each person to make sure that we entered it, and then we go in there and it's entered, but we notice that there's another entry. So I don't know if it's I guess, is there any way that we can, when we get dinged, we know which entry it is, I guess, so that I don't know if that's even making sense.
Yes, I think so. I think maybe we can follow up directly and we can talk through some specific examples. I think that may be helpful. Something that may be flagging that. And I'll ask, I guess, to clarify, are you finding like there's another project entry or there's like another client, like it's a duplicate? Do you know?
No, it's like we just had to do a report, and it was, oh gosh, I think it was like I entered the wrong, or it says I didn't enter the exit income or the entry income. I don't remember which one it was, but it didn't have any income when I entered them. They didn't have income, but I did notice that there was another entry with us, but like years before. And I think at the exit, it was like, wait a second, you said there was no income and there wasn't a change, so I didn't have to change anything.
Yeah. Yeah, I think it may be helpful for like the next round of reporting. I'm happy to like look through it with you so we can kind of drill down maybe what is causing that. It like to your point, it may be kind of tied to that previous entry. Um, but it may also be one of those like sub-assessments not getting like f com fully completed. That can flag it too. So let's maybe plan some time to go over some of those things together the next time that pops up, and I can help kind of drill down maybe what might be causing that.
Okay, thank you.
Yeah, thank you, Nancy. Good question. Phil, go right ahead.
Yeah, I just want to say I had a similar experience, but in my case, I think I figured out, hopefully I did, we'll know with the next reporting cycle what it was. So I had a couple of pop-ups for a particular veteran, sorry, a few times a row where basically the income at entry wasn't correct, and I couldn't figure out why. Because everything that I had recorded from my project was in there, it was correct. And then I realized as I opened up the detail for income that there had been a past project with another organization that had carried over somehow. So when I opened my project, it carried over income from a past project. When I closed that, we'll find out the next time, but when I closed that, I think it probably fixed it. It's just something that I would never have thought to look for, wouldn't have thought that would contribute in any way to my project data. But because it was being pulled into my project, it was probably flagging it.
Yeah,
So I just
that's a
wanted to share that because I ran into that and I'm like, wow, that's very different. I haven't seen that before, where it pulled it from another project and it was in my data.
Yeah, thank you so much, Phil, for bringing that up. That's a really good point. And this is exactly why making sure like all of those things have answers and they're accurate and reflective is really important because when you're adding a new project or an enrollment in a project for someone who has been served by another program or maybe by your own agency, but in the past, if those things, as they're porting over, you really want to make sure that you're screening all of those questions again to make sure that they're accurate because it can cause that exact issue. So thank you for bringing that up, Phil. It's a good
But
point.
I have gone back to close, and I always go back the day before I've opened them because I do notice that sometimes when it does have other projects on there, that you have to go in and close their old income. So I
Mhm.
always do that first, if
Okay.
unless it's like like a brand new person. But if it
hmm
there's multiple there, I make sure that I go back and close or end that income
hmm
before I enter a new one.
Okay. Yeah, that's good that you're doing that. We will take a look at like the next one that pops up like that, and we can drill down exactly what may be causing it. Other questions or thoughts? Alexis, I do see your question in the chat. Yes, we can definitely schedule some time to do that. No problem. All right. Well, if folks don't have any other questions, that is all I have for you today. Thank you so much for carving out the time. I know everybody is really busy, and I appreciate everyone getting together to go through these things. If anybody has any questions that do pop up, or like I said, if you want to follow up offline, please just shoot me an email. I'll be sending out to everyone the cheat sheet again, as well as the updated program standards and manuals. And so if you want to have some really like granular reading, please feel free to dive in. But here to help answer any questions that may pop up in the future. And if you are interested in getting information kind of on the reporting side, we do run a reporting training for folks that are kind of working on that admin level too. So we'll be meeting with those folks tomorrow, actually. So if you have questions, please feel free to field them to us at any time. You definitely don't have to wait for another training for that. So thank you guys. I hope everyone has a great rest of your day and everybody be safe and be well.
Thanks, Megan.
Thank you guys.
Thank you.
Thank you.